MedStar Health is a $4.5 billion not-for-profit hospital system that services the Maryland and Washington, D.C. area. Its 30,000 employees and 6,000 physicians care for 500,000 patients a year in its 10 hospitals. In 2011, the MedStar Montgomery Medical Center started a patient and family advisory council in an effort to increase the quality and safety of the patient experience.
If you think about any industry that's putting a product out or serving a customer in some way is always looking for the voice of the customer. In healthcare, we've been so long coming to that.
We walk by things every day and we don't see them, but someone that comes into the hospital probably would see things and would have some really good input for us.
The Patient Family Advisory Council sets a perfect opportunity for us to hear their voice and meet their needs and not carry on with healthcare based on what we think they need.
The purpose is to truly look at things from the patient's perspective and the family's perspective. Being a nurse, you can see things from a totally different aspect, and you think you are doing the best thing, the right thing, and from the patient's perspective, you're falling short.
It was almost like a no-brainer. Of course, we've been doing patient experience like every other hospital for 10 years or so, so it was really just something that the board thought, what a great idea. Why didn't we see that before?
That idea came from two staff members after attending a conference in 2010. This effort was supported by MedStar Montgomery leadership from the beginning. They have taken a proactive role ensuring the council's viability and success.
We did a search around the country of places that had advisory councils and used their wins and things that they would do different.
We found out that it wasn't as easy as we thought it would be, and so it took a while to really get a good nucleus of patients to come and serve on the council.
We actually went through an interview process to make certain that they were understood that they would be representing not just their own concerns, but also concerns of the people that they talk to and people that they associated with within our service area.
You want somebody who really is engaged and passionate, someone who's willing to take a negative experience and turn it into a positive.
Some of them have had a loved one harmed at the hospital. Others are just members of the community who've had good care and want to see that hospital achieve the best care possible because their friends and family get care there.
The Patient and Family Advisory Council, or PFAC, also includes representatives from the hospital, including nurses and physicians.
Both the hospital employees, the physician that participates, and the Patient and Family Advisory Committee team really have a passion for making this work.
I've got a couple of directors that are involved in it, and they believe in it so much that it just happens, and they make sure it works well.
My job is to make sure that we stay somewhat on track. It's a fairly informal process to be sure that we're including everybody around the table, to make sure everybody's voice is being heard.
The hospital is really asking us to provide, the eyes and ears of the community, the thoughts and opinions that they need to incorporate into whatever they're working on.
Being able to sit in the room and swallow hard sometimes and not say, oh no, a nurse would never have done that, or I'm sure that's not what the physician meant. You can't do that. You have to listen. These people chose to be on a council. They chose to take what probably was a negative experience and want to make it better for someone else.
I don't think they have given us anything that the council as a whole have not felt they wanted to take the challenge on. The items that the council have worked on have had an impact on the guidelines and the policies that the hospital have implemented.
The council has tackled many projects, starting with the patient's basic needs.
PFAC also had the idea that when reading a menu when you're in the hospital, sometimes you don't have your glasses, and the menus were just too small for the patients to read. We used that as a cue to increase the size of the printing on our menus.
They also took on patient falls.
We were looking at fall signs, and so we took that to a committee meeting, and we were shocked to find out that the sign that we were using, the committee found appallable. They just thought it was this horrendous sign that was frightening and kind of disrespectful. It was a person falling down, and they wanted some other sign done, so we actually changed our sign.
It really started a lot more conversation between the healthcare provider and the patient. A lot more explanation to the patient about, I'm doing this to protect you, to keep you from falling. I'm doing this to try and keep you safe. In the care provider's mind, that's obvious, but certainly not obvious to the patient who's having things done to them to protect them.
Council members are passionate about issues close to their heart, issues that are not obvious to the caregivers.
We had a member of the Patient Family Advisory Council who during the course of the council was hospitalized. And when he came back, he said he was sort of using his hospitalization as an opportunity to be a secret shopper. He had understood staff to tell him that during the time he was here, he was to stay in bed. It was another light bulb experience for the council.
And so as we worked on this project and launched a mobility program, we were to educate the staff on the hazards of immobility.
And we have a process in place now. There's a jingle that goes off at about 11:45 every day. And when that goes off, it's a signal to all the staff to go into a patient room and help a patient either get out of bed, if they're able to get out of bed, or to sit up.
And so we've gone to an area where we're trying to get them out of bed 3 times a day. And it was all from the Patient Family Advisory Council.
It's not all about the patient's concerns. The staff also introduces issues that are important and need to be addressed, like how to handle delirium.
When I took it to the group, most of them had never heard of delirium from the standpoint of it being a medical emergency. They hadn't heard of delirium as something that they should report immediately to a physician. They actually were embarrassed by it and thought it was a psychiatric disorder.
They have engaged now with the physicians, nurses, leadership, and members of the community to try to figure out how to attack the problem of delirium, how to reduce the risk of delirium in a hospital setting.
The Patient and Family Advisory Council provides their seal of approval for all to see on everything they do.
So whatever they were reviewing and giving their opinion on, they could then endorse it when they were finished. And that endorsement would go on the bottom of the video or the publication or whatever it was that we were putting out.
We felt honored to have a stamp of approval from the council to be added to documents and policies.
Now it's being used by the corporate group as well, so it's kind of expanded.
A PFAC allows patients to take ownership of their hospital experience.
This is my hospital. I feel a real commitment to this hospital. I've been in surgery here, I've been hospitalized here, I've had family members hospitalized here, so I have a real connection to this hospital.
We have felt valued, and we have offered our input, and they have taken a lot of our input, and they see us as a resource.
There are more and more employees understanding the role of the council here and seeking it out. So I think at this point, the Patient Family Advisory Council is really embedded here.
It's fun to see it. It's really exploding now with this structure that we've put in place.
A PFAC will really help you run your hospital more effectively. There are things that affect our patients' experience where we as clinicians are not the experts, but the patients are.
Your hospital is going to be better and you're going to have less problems. So again, it's just the smart thing to do.
I'm Armando Nahum, patient advocate and principal of H2PI. On behalf of VHA, I encourage you to contact us on how you can implement a Patient and Family Advisory Council for quality and safety in your facility.